did have some questions specifically from the group if you have a few more minutes.
Yeah, that's fine.
I get a lot of questions about neuropathy and pain. A lot of people have pain after they have COVID, and it doesn't even make sense. And it certainly, for a lot of cases, doesn't even seem connected. And I'll give you an example. After I had COVID last January, my feet just became so sore. I took LDN for 3 months. That helped a lot, but it didn't fix it. It's gradually gotten better over the year, but now my husband is having like these crazy shooting pains in his arm. His arm is atrophied now. He can't lift things. He has a difficult time putting on a shirt. It's crazy. So what are you doing, or what are you seeing for pain with these patients?
Well, in that case, I would recommend you getting an EMG to rule out Parsonage-Turner syndrome, because that could happen. But with those big pain complaints, for neuropathic pain complaint is usually the number one thing that I get. The hands, feet are burning, or their muscles feel cramping and dull, deep ache. And it's, I do nerve conduction studies as a part of my practice too. So I do needle EMG nerve conduction studies. We look for myopathies, which sometimes can be a result of long COVID, but typically that's not very common. Usually it's like a small fiber neuropathy. They'll get this test done and it's completely normal, and they're kind of disheartening. It's like, no, you want that test to be normal. You don't want a big nerve or big neuropathy going on. It's usually a small fiber issue. So using things like Formula C could help with generalized aches and pains and pain complaints. There's a cream by the same company, Endurage, that's called Verisome. It's kind of like the Voltaren gel killer. It's safer, doesn't have any systemic absorption that can mess up your kidneys, your stomach, or cause any heart issues. I use that for very superficial type pains like hand pain, wrist pain, elbow pain. I use it myself on my elbow all the time. I have medial epicondylitis, knee pain, and it's a very safe cream that you can use as many times as you want. Other things for those types of things, there's other types of products, something like Serofolin or Metanex is by another company too that could help with neuropathic pain. It essentially gives nerve the building blocks to help regenerate and help become healthier. So it's typically supplements. I stay away from anti-inflammatories that can mess up your stomach that's already probably messed up already from long COVID. Anything that could affect the kidneys or anything that could affect the liver. Tylenol is okay from time to time, but usually I like giving more of the building blocks. The way I like to say it's like, I don't like giving medication because when you give a prescription medication, your body has to metabolize it to the units that it needs to use, to the substrates that your body needs to use in order to get pain relief. I like giving my patients the building blocks already, so that way the substrate's already there that they can use instead of having to metabolize it. I like to give them the Legos to build the Lego set rather than giving them the plastic and saying, hey, you need to build the Lego to get the Lego piece to build the Lego set, if that makes sense.
Yeah, great information. Thank you very much. Another question that's really burning for a lot of people, and I think I know the answer. I was saying it originally, but people were not receptive to hearing it. So here's the big question. Is long COVID permanent?
I can't answer that. I've had it since 2021, and there's days where I feel perfectly fine, but then there's some instances in my life that, I know that things are different. Like I have something called recurrent viral infection syndrome. When I get sick, like a little simple head cold, before I could, shake it off, be fine. Now it puts me out, and I can't do anything. My allergies are bad. But I can't answer that question because I don't know, one. But two, I know that it's very, very much possible that you can become functional and live a happy and healthy and desired life and have a very functional and happy quality of life from long COVID. Because I've seen people who are barely able to get out of bed to traveling the world now. And yes, they have flare-ups. Yes, there's some hiccups that can happen. But I can definitely, you can definitely improve and live a long, healthy life and happy life.
It's the same thing I say. What I do know and what I've seen in thousands of people is when you get COVID, if you have long COVID afterwards, you may not get back to 100%. Some people get very close, but then when they get reinfected, if you're only at like 90% or 80% recovered when you get reinfected again, that 80% becomes your new baseline. It's your new 100%. For me, it's sad to say, but every time I get COVID, I lose an organ. I had COVID last month, and now I'm having cardiac stuff that's been more persistent, and I never had that before. Well, I had a little episode, but it corrected itself, right? This is just persistent. I've lost my appendix. I lost my uterus. I lost my tonsils. I have complications from COVID, but I cannot sit here and think about it all the time.
You can't let yourself do that.
Right.
You can't become obsessed with this. This is COVID. This is what's COVID. If it is, it is, and we move past it, and we move forward, and we try to be at the top of our game as much as we can. That's all we can ask for at this point.
It's more like, my perspective is that once you learn your triggers and start learning the true meaning of self-care, which means sleeping, eating properly, hydration, exercise within tolerance, important phrase, exercise within tolerance. But when I can keep those things in balance, I can manage my symptoms. And when I manage my symptoms, I can be very active. Sometimes I have to go to bed early, though.
Yeah. And it's funny how you say that, because I think COVID has taught us a lot of things. Long COVID definitely is teaching us a lot about our bodies and how we need to care for that. But also with COVID, how COVID was, the whole thing was, make sure you wash your hands, make sure you stay home when they're sick. I'm like, did people not know this? Like, is this a new thing? So now we just need to be more in tune. It's kind of like relearning the basics. It's like, if you know that this triggers a flare up, let's avoid it. Let's adapt. Let's do something to change that, to avoid those flare ups. And then going back to what you're saying about the percentages, the way I always tell my patients, it's like, especially in the beginning, it's like, if I could say, hey, we do this and I could get you feeling 60% better, most people are going to take that offer. It's like, yes, I want to feel 60% better. That would be night and day difference. I never promise a patient 100%. You're going to be 100% back to, sometimes it happens. Sometimes people will feel better than what they did prior to their COVID infection. But that's a case-by-case basis. The most important thing is to try to become as functional and independent and happy as you can, and having a quality of life that you're happy and a quality of life that's desirable to you.
And that's going to also help reduce the anxiety and the depression.
100%. 100%.
The more we repeat a message to ourselves, the firmer that belief becomes in our brain. And so if we can repeat, I'm just moving on. That's what we have to do. Yeah.
Don't let long COVID dictate your life. You dictate your own life.
Exactly. So I have some other poll questions for you. Some people are talking about shortness of breath, and that might be a little bit too much for this conversation. I know that there is a lot of neurological issues going on. So with shortness of breath, we've got lung inflammation. We might have the vagus nerve branch that's controlling the lungs or the diaphragm spazzing and making it difficult to breathe. But it's a true thing that people might be 100% oxygenated and then still feel like they're short of breath. Have you had any insights on that?
Yeah, 100%. I mean, like I said, a lot of the times people get spirometry, PFTs, and they're normal. Their lungs look normal with an X-ray. They get a CT, it's normal. The pathology behind it, I'm not 100% sure. I don't think anybody is. But, there's different things. Definitely be evaluated by a pulmonologist just to make sure there's no permanent scarring or any other issues. I've had patients get like atelectasis or even like bronchiectasis, kind of getting like an acquired asthma, so to speak. But, I mean, for shortness of breath issues, I use Formula C. That seems to help out a lot with the inflammatory pathway. It kind of lowers down any inflammation that may be happening in the lung. Other modalities is something called flow therapy or EECP. That seems to help out a lot with a variety of complaints. The physiology behind it, the way I explain it to patients, that it just helps improve circulation and make collateral blood flow circulation and repair the endovasculature of our veins and arteries to help promote healthy oxygenation to different areas where there may be hypoxia, but we're just not seeing it. And so that's a rabbit hole I can go down for a long time with the shortness, because that's a huge thing that patients have. Like I feel like I can't take a deep breath. I feel like I'm just always winded. And so we use things like Formula C and different supplements to help improve whatever's happening in there, because I don't know what's happening. I try these safe supplements to see if it aids in any particular way or any helpful way.
The next big question, I think this is where we'll wrap it up for the day, but post-exertion malaise. People are experiencing that, a lot of questions about it. How are we supposed to move and be active, even if minimally, if PEM is just going to happen?
So that's the whole point. For me being a rehab doctor, it's all about tolerance. It's all about activity modification and knowing your limits. There's different things that I do in my protocols that can help improve endurance. but it takes time. It's baby steps. You can't expect, I've had marathon runners come to me that were marathon runners before COVID, and all of a sudden, they could barely walk to the mailbox without feeling like they ran a marathon. Different things that help with that. EECP helps tremendously with post-exertional malaise. Creatine helps build muscular endurance. Formula C is another thing that helps with post-exertional malaise. And then once I get patients to a point where their fatigue level, where they feel like they have enough energy and enough capability to do something, whether it's some type of physical modality. A lot of the times providers put patients into therapy, or they do these very invasive or very involved modalities right away, right off the bat, and they're not ready for that. I like to get my patients to a point where it's like, okay, we're going to do these baby steps to get you to a point where your fatigue is not disabling, and then we start to become more aggressive with our treatment plan. We start fine-tuning things. So once I get my patients to a point where they feel like they can, go to a therapy appointment maybe once a week and do these different things, I have discussions my department has discussions with a physical therapist at a specific institution, and we have a protocol. It's a graded physical therapy program. We do things that are very simple, from we're going to teach you how to conserve energy from getting up off a chair, to bending over and tying your shoes, to walking to your mailbox, and it's graded. So based on how you're feeling, they advance. Instead of just throwing you, okay, do these leg presses and let's build your endurance. There's no way. So it has to be a graded approach and tailored individually to each patient.
Yeah, I can give some firsthand experience with that. I mentioned that I had COVID in 2022, January. By February, I had an emergency appendectomy. The inflammation was just crazy throughout my whole gut. Mm-hmm. Then in June, when I was recovering, I needed to get back in. So I tried swimming, and I swam 2 laps, and I noticed my fingernails were black.
Yeah.
And my fingertips. So I stopped swimming. I rested the next day. I went back, and then I did 4 laps that time. And I'm not Olympic swimming here. I'm just doing my little informal breaststroke slowly. I was able to get 4 laps in, and then my nail beds were purple. So better than black. Yeah. Then again, rested. 2 days later, I could do 6, and they were bright red, like fire engine red. And then I rested again. It all seemed to naturally come together for me. I definitely had to pace it, but by the 4th time I went swimming, I could do 6 laps, and then suddenly I could do 16.
It's all a graded process. It looks like you have the COVID toes,
yes.
The blue toes, the blue fingers. Yeah. It's all graded, and it's all tailored to what you're able to do. It's great that you're able to go out and swim some laps, but for some people, going to the mailbox and back is enough. It's enough for day one, and maybe a couple of days later, maybe go to the edge of the curb and back, and then maybe go down a block and back. So it's all based on what you're experiencing and what you're able and capable of doing. And there's no right or wrong answer. We need to build you back, and it's going to be slower than it is for others. Sometimes it takes a long time. Sometimes people bounce back quickly, and that's not to be discouraged. Everyone's going to have their own experience with it, get their own experience with getting back to where they need to be. But as long as they have that in their mind that, hey, this COVID doesn't dictate the way I live my life, I dictate it, and it's going to be a little bit longer for me to get there, but you're going to get there.
And I think it's really important, if you have that level of severe fatigue, ask your doctor to have a physical therapy or an occupational therapy referral, because they can monitor your biometrics as you're moving along. And that helps give you a safe start, because with the depression and anxiety that comes with the neural inflammation, there's also fear about getting sick, having a flare-up. Mm-hmm. Can I do this? Am I going to have a heart attack if I walk? These are very valid questions.
They are, yeah, especially patients with autonomic dysfunction. When their heart rate shoots up to 180 from standing up, those are things that need to be monitored by a professional. And this is why I like sending, especially patients who are that debilitated, to go, once I get them to a point where they're able to go through, a professional like a physical therapist, occupational therapist, and do a graded program, because they're monitoring your blood pressure, they're monitoring your pulse oxygenation, they're monitoring your heart rate. And it's always also just for your own peace of mind to know someone's there. That if something were to happen, God forbid, that they'll be there to assist, or to at least bring the appropriate personnel to assist. Right. It's not something that you need to do alone, and there's trained professionals to help you every step of the way.
Is it similar to the doctor situation, where not all physical therapists will be aware of how to implement this? So what are the key factors to look for in a therapist?
So for our department, we have affiliations with certain therapy programs, and we talk to the therapist, and we kind of give them an understanding. Hey, these aren't the typical patients. This is someone coming in for, rehabilitation of their low back pain. Like, they're debilitated. You need to treat them like a debilitated inpatient patient. So we need to start slow. We tell them things that I put in my orders when they're not going to my preferred therapy facilities is make sure you're monitoring their oxygenation, make sure they're monitoring their blood pressure. I put parameters. So if their blood pressure falls below 100 systolic and 60 diastolic, stop what they're doing. Make sure they're hydrated, lie them down, lift their legs. I put parameters into the actual order. I also put in there a work on energy conservation techniques in a graded fashion, focusing on activities of daily living and mobility. And I capitalize graded. And I tell the patients, when I tell them, I want them to start the most basic thing. And so that at least they go in with that understanding. So if the therapists aren't familiar with long COVID, at least the patient understands what their responsibility to kind of be the advocate for themselves, being, hey, I need to start slow. You don't have to do anything that somebody tells you to do. You say, hey, I can't do that. That's too much for me. We need to back it up and then go from there.
Yeah, one of the sneaky things about it is that with the post-exertion situation, sometimes you may feel like you can do more, and then the next day or two, you have some really bad backlash. It's bad.
You feel it. It's like, I felt great today, and then you're going to feel it tomorrow. So, that's going to happen. It's like, going to the gym for the first time in years, you're going to feel it. So You just need to pace yourself.
Maybe you have to set a timer too. So I had built up my endurance that I could swim 32 laps. And then this one day I just felt so great. And the water was just like the perfect temperature. I stayed in for an hour. I was kind of treading water extra to just build up my strength and such. And I got out of the pool, and my husband said I looked like I was having twins again. Like, my belly was so blown up, and I had no sense that was going on. So I gained probably 3 to 4 inches in circumference on my stomach after that swimming with no idea. And then that inflammation took a long time, like months, to come down. And I did not know about Formula C at the time. So I wish I had, because I think it might have helped.
Yeah, 100%. I mean, that's something I take Formula C at night myself. I've given it to family members, a lot of my patients, and I use Verisome as well for musculoskeletal issues as well. Another thing, like for if patients are if you're in a community that maybe there's not a lot of options, there's a Instagram or Facebook, I forget what it is, but one of my old time friends does it. I think he's a physical therapist trained, or maybe he just has a degree in exercise physiology. It's called Grow Young Fitness, and he does very simple exercises from like the chair, standing up from a chair, very simple things. And that's always a good start, kind of just to see where you're at, doing something like that. Just doing, there's a lot of resources out there that have very manageable activities and very simple activities that you can do from home to go from there.
Seated yoga is also an option. And even trying to do breath work. It's so important to bring your oxygen in. It resets your body and your nervous system, but it preserves your organs. But if you're sitting down to do 10 deep breaths, breathing in slowly and breathing out, that when you first have long COVID can be a lot. It's hard to do just that, sitting down and breathing properly. It's very difficult.
Read an article called The Benefits of Breathing into a Balloon. And it's a great way to open up your lungs and really humble you of how much energy breathing alone does. It takes from your body.
And think of it, your lungs are muscles. And if you've been sick and they've been compromised by this infection, they're going to need time to get back in shape, just like your legs and your arms. So it's very different. And your diaphragm muscles, everything. That was called Benefits of Breathing. What was the last word?
The Benefits of Breathing into a Balloon. I believe that's what it's called.
I think you're right. I think I've heard of it. Of course, if you have a latex allergy, don't do it.
Don't do it. Yeah. Find a nitrile balloon or something.
Well, this has been really, really helpful. I know that thousands of people are going to see this, and it's going to put their minds at rest about a lot of the questions they've had. And I hope that we have another opportunity to talk. I really appreciate everything you're doing, and thank you so much for joining us.
No problem. I'm here to help.
Thank you.